Hello everyone, myself Karaj Dhruvi and I am going to explain about ACL tear management. The first phase is maximum protection phase, which lasts from day 1 to week 4. In that, the first component is patient presence. Patient presents with post-operative hemarthrosis, post-operative pain, decreased range of motion, diminished voluntary quadriceps activation, ambulation with crutches, and patient will be or may not be present with protective bracing. The second component is key examination procedure. The therapist have to examine pain scale, joint effusion by girth measurement, range of motion, ligament stability by joint arthrometer, patellar mobility, muscle control, and functional status. The third component is goals. Goals are as follows. First is to protect healing tissues. Second is to prevent reflex inhibition of muscle. Then decrease the joint effusion. Then ROM from 0 degree to 110 degrees. Then weight bearing should be from 75% to weight bearing at tolerance. And then last is to establish home exercise programs. Then comes the intervention for this phase, which is maximum protection phase. It is further divided into early and late. Early means days 1 to 14. It includes PRICE, which is protective bracing, rest, ice, compression, elevation. Then comes gait training with crutches and from partial weight bearing to weight bearing at tolerance, active and passive range of motion, muscle setting isometrics, patellar mobilization, that is just grade 1 and grade 2, ankle pumps, and assisted SLR in supine. Then comes the late intervention, which is from second week to fourth week. This includes progression to full weight bearing. We have to initiate closed chain squats, and also we have to give heel raises and toe raises. Also SLR in all four planes. Then aerobic conditioning, which can be given by stationary cycle. Also, we have to initiate the open chain knee extension and ranges from 90 degrees to 40 degrees, and then last trunk or pelvis stabilization. That was all about maximum protection phase. Now we'll talk about moderate protection phase, which is from week 4 to week 10. Here also there are four components, that is patient presentation, key examination procedure, goals, and intervention. Let's talk about the first component, that is patient presentation. Here the pain will be controlled, the effusion will be controlled, the range will be from full to near full range of motion. The grades of MMT will be from fair plus to good, that is from 3 plus to 4. The ambulation would be independent. The key examination procedure includes a pain scale, range of motion, patellar mobility, and ligament stability by joint arthrometer, joint effusion by girth measurement, muscle strength, and last is functional status. Those include full pain-free range of motion, a grade 4 out of 5 of muscular strength, that is of MMT, improved kinesthetic awareness, dynamic control of knee, normalized gait pattern, and ADL function, and adherence to home programs. About intervention of this phase, which is moderate protection phase, it is also further divided into early and late. Early means from week 5 to 6. The early intervention includes multiple angle isometrics, advanced closed chain strengthening programs, PRE, which stands for progressive resisted exercises, lower extremity stretching programs. It also includes endurance training, bike, pool, etc. Also includes proprioceptive training, which includes tilt board, BAPS board, single leg stance, then also stabilization exercises, band walking, etc. Now comes the late intervention, which is from week 7 to week 10. Late intervention includes advanced strengthening, which includes PNF patterns, advanced flexibility and endurance training, then advanced proprioceptive training to high stepping drills, unstable surface challenge, balance beam, etc. It also includes to initiate plyometric drills, which includes bounding, jumping, and also to initiate the jog or walk at the end of this phase. That was all about moderate protection phase. Now comes the minimum protection phase, which is from week 11th to 24th week. Also, the first component is patient presentation. Patient presents with no pain, no instability, no swelling, good to normal grade of muscle strength, that is from 4 to 5. Then unrestricted ADL function, and last is possible use of functional brace. The second component is key examination procedure, which includes three things. The first is ligament stability by joint arthrometer, muscular strength, and the last is functional status. The goals for this phase is to increase strength, to increase power, to increase endurance, to improve neuromuscular control, dynamic stability and balance, and also to improve cardiopulmonary fitness. Then comes the intervention of this phase, which is minimum protection phase. It includes continue lower extremity stretching program, initiate the isokinetic training or advance the PRE, advance closed chain exercises, plyometric drills, also to advance the proprioceptive training, includes progressive agility drills. It also includes simulated work or sport specific endurance training, and lastly to progress the running. Then comes the last phase, which is return to activity phase, which lasts for more than or equals to 6 months. The first component is patient presentation. The patient presents with no instability and 70% function of the uninvolved extremity. Also, no symptoms of instability, pain, or swelling. Use of functional brace or sleeve during high demands of work or activities. Then comes the second component, which is key examination procedure. This includes full clinical examination, ligament stability, muscular strength, and functional testing. Then comes the goals for this phase. It includes increased endurance, increased power, increased strength, and regain the ability to function at highest desired level. Also transition to maintenance of the program and reduce the risk of re-injury. Component, which is intervention of this last phase, includes continue to progress PRE and flexibility exercises, advance the agility drills, and last is to determine the need for protective bracing prior to return to the work or sport. So that was all for the management of SEL TER. Thank you very much.